Outside this Beijing pharmacy, a crowd desperate for cold and flu medicine. I'm worried, he says, especially now that the entire country has opened up. I'm afraid I'll get sick. On social media, signs of desperation. Hospitals so crowded with COVID patients, people receive IV medication from their cars. A crisis brought on by the end of lockdowns just as the virus was spreading in a community with weak immunity. Officially, China has reported around 2,000 daily COVID-19 infections over the past couple of days, but those numbers represent a fraction of cases. China's lack of primary health care means people crowd hospitals where the people treating them may be sick.
Throughout China, people who are infected, those medical doctors already being tested positive, they are still required to work in the medical setting.
China uses a locally produced COVID vaccine, requiring additional boosters.
So the question, I think, and the challenge that China and other countries still have is, are the people that need to be vaccinated adequately vaccinated with the right vaccine and the right number of doses? And when was the last time those people had a vaccine?
China today announced plans to increase vaccinations for the elderly and most vulnerable. And while it's rejected offers of American help, it does have a supply of Pfizer's Paxlovid to treat severe COVID cases.
It does seem like the trajectory is to, let her rip and sort of deal with the consequences.
People seem to be taking their own precautions. Beijing's streets and malls are largely deserted. People too sick or too worried about getting sick to leave their homes. Lindsay Duncombe, CBC News, Vancouver.